We'll go ahead and call our August 27th meeting of the Rutherford County Benefits and Insurance Committee meeting into order. Before we get into approval of the minutes and the other agenda items, I will read our electronic meeting determination. This meeting of the Benefits and Insurance Committee is being conducted electronically pursuant to Governor Bill Lee's Executive Order 16. I would ask for a motion that the conducting of the meeting electronically is necessary to protect the public health, safety, and welfare in light of the coronavirus. Is there a motion?
So moved.
Who was that? Can you please list your name? Thank you.
Mary.
Thank you, Mary.
Mary Hickerson. Is there a second?
Second, Jeff Phillips.
Jeff Phillips on a second. Any questions? Seeing none, please call the roll, Madam Clerk.
Yes, sir. Preble Acton. Yes. Rhonda Allen.
Yes.
Dr. Andrea Anthony. Dr. Andrea Anthony. Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell. Shay Crowell. Holly Deering. Holly Deering. Alan Farley.
Yes.
Mary Hickerson.
Yes.
Lois
Hi,
Miller.
this is Holly Deering.
Thank you, Holly.
I apologize. I couldn't get it unmuted.
Okay, I marked you. Thank you, Holly. Lois Miller.
Thank you.
Yes.
Alan McAdoo. Jeff Phillips.
Present and yes.
Shantae Sherrill.
Yes.
Eric Tutobeni.
Yes.
All in favor. Do you want to call roll?
We have I'm sorry? Yes. All right, Madam Clerk, if you would please call the roll. Let's see if we have a quorum.
Preble Acton. Rhonda Allen.
Here.
Dr. Andrea Anthony.
Here.
Doug Bodery.
Here.
Amber Brown.
Here.
Shay Crowell. Holly Deering.
Here.
Alan Farley.
Here.
Mary Hickerson.
Here.
Lois Miller.
Here.
Alan McAdoo. Jeff Phillips.
Present.
Shantae Sherrill.
Present.
Eric Tutobeni.
I'm here.
Thank you. Mayor, we have a quorum.
Chairman detects a quorum, so we are now prepared to conduct our business. Chair will entertain a motion to approve the minutes from the last meeting. Is there a motion?
This is Mary Hickerson. I'll make a motion to approve the minutes.
Motion to approve the minutes from Mary Hickerson. Is there a second?
This is Andre Anthony. I second the minutes.
I didn't hear who that was.
Could you give me the name? I'm sorry, couldn't hear.
This is Andrea Anthony. I second.
Thank you, Dr. Andrea Anthony.
We have a second. Any additions or deletions? Please call the roll, Madam Clerk.
Preble Acton. Yes. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Holly Deering.
Yes.
Alan Farley.
Yes.
Mary Hickerson.
Yes.
Lois Miller.
Yes.
Jeff Phillips.
Yes.
Shantae Sherrill.
Yes.
Eric Tutobeni.
Yes.
Thank you. All in favor?
Okay. Item number 2, members, is on the agenda, financials. Mr. Elam.
Mayor Ketron, we have 2 months on the 264 fund, and we also have 2 months on the 266 fund. I'll start with June on the 264 fund. For the month of June, your revenue is going to be $7,244,730. Your expenditures for the month of June 2020 is going to be $10,410,204, and with a revenue less expenditure of a negative $3,165,474. If you look for the calendar year, your totals for those 6 months is going to be $48,306,953 in revenue, compared to $40,183,232 in expenditures. Revenue less expenditures are on the good side at $8,123,721. If you look at the fiscal year for 2019-2020, you'll see that for the month of June, that will give us our entire year. And the comparison there is revenue is $80,178,931. Expenditures is $79,466,833. And the revenue is on the plus of $712,098. And so for the end of the year, if you look at that, the revenue over expenditures, I'll just point out that that's less than 1%, which is extremely close. For the month of July, your numbers for July 2020, your revenue is $1,728,704. Your expenditures are $6,612,422, and that's a negative $4,883,718. And you had a total enrollment was 6,233. If you look at the total for July, you will see for the calendar year, the total is going to be $50,035,657. Expenditures is going to be $46,795,655. And your revenues on the plus side of revenue less expenses is on the plus side of $3,240,002. And of course, on the fiscal year side, since it's only 1 month, the totals for it's going to be the same. Going to the 266 fund for the month of June, I will point out that as a reminder, in July 2019, we went from CCMSI to Collins & Company, and to make sure that bills weren't paid twice, and to try to get all of the data input it and get it correct. They didn't pay the bills for the month of July, and that'll show up on the next one. But if you look at the tracker, you will see year to date. Well, let me give you the June month. There's $25,169.75 for claims. I will point out that workers' comp is $2,629.71. OJI was $22,540.04. That's the breakdown of the claims paid. If you look at the year to date, you will see last year, the year to date at the bottom, far right hand side, $785,850.94. And this year, the year ended up at $637,004.73, and we were down approximately 19% in claims paid compared to last year. For the month of July, in the 266 fund, you will see on the claims paid is $70,988.61. And of course, that's going to be your total for the fiscal year. So your year-to-date is going to be the same. And again, pointing out that because of the change of our third-party administrator to Collins & Company, there were not any bills paid for July 2019. So that's why your box at the bottom is empty. I will give you the breakdown of the $70,000 on the 266. The workers' comp part of that was $32,510.99. The OJI part was $38,472.62. Mayor Ketron, that concludes my report.
Thank you, Mr. Elam. Those numbers are trending in our favor. Thank you. Looks good. Next, we have the
Can
county.
you make a motion?
Motion to accept the report.
I'll make that motion, but I also have a question, and this is Mary.
Hi, Mary. Yes, ma'am.
I'll second the motion.
Second on the motion. Mary has a question. You recognize Mary.
And if we're looking at the 264 fund, are we seeing the increase? Let's just go to the fiscal year. That increase of expenditures of almost $10 million, is any of that, we seeing an uptick because of the coronavirus, like the folks that are getting tested? Or actually, I don't know that we even have a way of tracking, specifically to our folks, but is some of that because of the COVID-19 and hospitalization due to that? Or I know usually in the summer months, teachers and other folks are getting stuff done then, whereas we're not getting the revenue in the teachers because they pay 10 months, they're 12 on 10-month things. So do we have a way of seeing that's why we're almost 10 million over this time last year?
Well, in that number is a glaring number as it stands out. But I met with Lisa, and I've also talked to Mercer, and I've also looked into, I had the same question you had with the COVID-19. And it is not, that number is not a reflection of increase in claims due to COVID-19. Our claims have been very low, and with hospitalization or anything. So, according to the numbers from Cigna and Mercer, and the number that we're looking here, one of it was, and according to what Lisa said, was that this is a number that was incurred but not reported. So from a budgeting standpoint, she has to go and figure the expenditures for what she would anticipate that were incurred in this year, fiscal year, and but yet it wouldn't be billed out till like July or so. And she said, according to what my conversation was with her, that there was approximately $1 million more over what it was last year.
Okay, thank you.
Director Nolan, you're recognized.
Oh, there you are.
What Ed just said.
What he just said?
What Ed just said. I was going to.
You second?
I can't vote.
I know, but you second what he
yes,
just
I do
said.
second what he said.
Okay. All right. All right, we have a motion and a second. Any further discussion? Seeing none, Ms. Corbin, if you would please call the roll.
Yes, sir. Preble, Acton. Yes. Rhonda, Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Holly Deering,
Yes.
Alan Farley,
Yes.
Mary Hickerson,
Yes.
Lois Miller,
Yes.
Jeff Phillips,
Yes.
Shantae Sherrill,
Yes.
Eric Tutobeni.
Yes.
Thank you. All in favor?
All in favor? Motion passes. Next, Mr. Good, please come on up.
Sir,
Oh.
before that, Ed would like
Commission, he can come on up, but, yeah, if I could just mention here real quick, I try to bring back, this is being a recommending body to the county commission, I want to give you an update on the voting of the county commission on the FSA rollover from 500 to 550. It was approved by the county commission. And then also the Motivate Me incentive changes that that the committee recommended. It was also approved. And then after having a conversation with Mayor Ketron and trying to figure out what we were going to do on the health fair status, we've decided not to do the health fair this year, but we have extended our open enrollment an extra week. So we're going to have open enrollment this year for 3 weeks instead of 2.
Any comments? Okay, thanks. Thanks for the information, Mr. Edel. Mr. Good, Dan Good. OSHA report, Public Safety Committee.
Good afternoon.
Yes, sir. Good afternoon.
Good afternoon. This afternoon, I would like to report for the month of June and July, if I may. In the month of June, we had a total of 14 injuries requiring medical attention. That brought the year-to-date total to 74. Of those 74, 56 were OSHA recordable, 38 had restricted days, 8 lost time days, and 10 all others. As you look at the next page of your report, you'll see that for the year we've had a total of 74 compared to this time last year, 134, and the year before that, 124. As far as the incurred dollars for the month of June, we incurred a total of $82,500. That brought the total to $282,000 compared to last year of $268 and the prior year of $288. On the last page of the report for June, we broke out those injuries. 7 of them were with the Board of Education, 6 with the County General, and 1 in the Highway Department. And then at the bottom, we broke out the 6 for the County General. They were with the Sheriff Department, Paws, and Fire and Rescue. That completes the report for June. For the month of July, we had a total of 8 injuries requiring medical attention, bringing the total for the year-to-date to 82. Again, making those total recordable for the year-to-date 60. 39 had restricted days, 10 lost time days, and 11 others. Compared to the end of July of last year, 82 this year to 145 last year and 135 the previous year. In the month of July, we had $57,500 incurred estimated losses for those injuries, bringing the total for the year-to-date to $340,000 compared to the previous year of $268 and 2 years ago to $311. Of the injuries for the month of July, you'll notice that the Board of Education had a total of 5, County General had 3, and the County General was broken down with the Sheriff Department, PAWS, and EMS. That completes my report for the 2 months. Are there any questions?
Well, look good, Mr. Good. Is there any questions? Is there a motion?
Move to approve the report, Mr. Chairman.
Thank you, Speaker Pro Tem. Motion, is there a second?
This is Lois. I'll second.
Have a second. Madam Clerk, please call the roll.
Travel Acton. Yes. Rhonda Allen.
Yes.
Dr.
Andrea Anthony.
Yes.
Doug Lottery.
Yes.
Amber Brown.
Yes.
Holly Kieran.
Yes.
Alan Farley.
Aye.
Mary Hickerson.
Yes.
Lois Miller.
Yes.
Jeff Terrell. Eric
Yes. Yes.
Thank you, sorry. Eric Tuto Benny,
Yes.
Jeff Phillips,
Yes.
thank you. All in favor.
Motion carries. Thank you, Mr. Goode. Yes, sir. Next, we have the midpoint report from Ms. McNair. Shannon? Ms. McNair, are you with us?
Yes, I am, Mayor. Sorry about that. I was on mute. Can you hear me now?
Yes, ma'am, we sure can. Go ahead.
All right. So we're going to look at our July report on the first page there for this month. For July of 2020, we had a total clinic visit at 786. You see that broken down below there. We had 635 provider visits. And again, just a reminder, we're still seeing quite a bit of virtual visits in our center, both telephonic and video. And those are captured there in those provider visits since they're seeing providers for those visits. We had 89 medical assistant visits, which capture labs and injection-only visits. We had 27 biometric visits, 5 occupational health visits, and 30 wellness visits with our dietitian. Our non-face-to-face encounters, we had 394 for the month of July. That includes 75 orders only, 196 communication encounters, whether it be via telephone or portal communication, and 123 results reviewed with letter communication out to our members for last month. If you look at the next slide, we like to break down our provider visits so you guys get kind of just an overview of the different types of provider visits that we're seeing in our centers. And so the virtual visit, and this includes the video and phone, we saw the most of that visit type for last month at 266 visits. We saw 216 in-person office visits between our 3 centers and 83 annual physical exams, 24 sports physicals, and 15 well woman physical exams. The next slide there, you see our clinical quality metrics. So at the bottom, you see our 2020 year-to-date for diabetes testing. We're at 92.52% of those with the diagnosis of diabetes having their A1C checked in the last 6 months. For diabetes control, with an A1C less than 8 for those that have a diagnosis of diabetes, is at 68.22%. And with the hypertension control of less than 140/90 is the goal for that, and we're at 72.75% for that. If you'll look at about 2 slides over, we're going to look at our month-to-month trends, and it's just tracking the visits that we're having in our total clinic visits in the center. If you look at 2020, you do see a decrease from 2019 at this time last year, and I just want to call out there, the biggest difference we're seeing is that there's no wellness initiative requirements this year due to COVID-19 with that being waived. So we're not doing near the volume of biometrics that we have done this time of the year in years past. So there's a big difference between those two, 2019 and 2020 for July. And then the next page, 394 non-face-to-face encounters. And again, just looking at that big difference from July of last year to July for this year, and not reviewing and sending out as many communications regarding lab results from those biometrics, or as many office visits to go over those lab results when patients have some abnormal results. So we're seeing some impact from that there. And then on the last slide, we've got our PEPM summary. So for July of 2020, we had 546 total unique members between our three centers. Total operating costs at $222,271. Employee count at the end of the month last month was 6,233 for a PEPM of $36 last month. And that concludes my report. Do you have any questions?
Any questions for Ms. McNair? Any questions? Any comments? All right. Thank you so much. We appreciate that. If you would please call the roll. Oh, we don't have to. All right. Got it. All right. Next we have wellness report. I inadvertently marked that off and skipped over. So wellness report from Chuck Chappa. Mr. Chappa, are you with us?
Yes, sir. Can you hear me?
Yes, sir. We got you. Go ahead.
Excellent. Thank you very much. So the August report for the Motivate Me Wellness Incentive Program, again, we're kind of continuing to report on this just because we want to see what the difference in impact with the COVID-19 and everything has made. So right out the gate, annual physicals, we're currently sitting at 1,508 versus 1,419. We're actually up a little bit. Biometric screenings, 1,928 versus 2,438. Health assessments, that online health assessment, 461 versus 1,158. Mammograms, we're currently sitting at 829 versus 818. OBGYN screenings, 1,384 versus 1,405. Colon cancer screenings, 320 versus 300. Cervical cancer screens, 1,176 versus 1,224. Prostate exam screenings, 351 versus 265. Flu shots, 1,876 versus 1,700. And to date, currently, if the program was active, you'd have 2,491 completed all of their incentive requirements versus 2,720. I'll go ahead and switch gears. We've had a really successful period of using the mobile mammography bus with St. Thomas. I want to extend a huge thank you to the Board of Education and Dr. Anthony for helping me get that on site. That was really successful in that regard. You can see there, we've actually done 4 different events on site at the Board of Education with mobile mammography. And then we've got another one coming up. We've at least got the time slot scheduled for September 3rd. We're just going to identify where to put it to get the best resources. And then again, to piggyback off of what Director Elam said, the new incentive program enhancements were approved, so we're currently working on the collateral and all the communication pieces for that. So as soon as those are complete, Dr. Anthony, I'll be sending those over to you for the Board of Education, and then we'll be working to disseminate that and get it also into the open enrollment materials. And that will conclude everything I have if there's no questions.
Thank you so much, Mr. Chappa.
Mayor Kentron,
Mr. Elam.
If I could just mention something really quick. I know the flu season, flu shots are coming around. Just wanted to remind you, being with 1 point, if you get it before October 1, it won't count to your points, but if you wait till after, I'm not advising people, I'm just reminding people that on your points. If you wait till October 1st to get your flu shot, then it will go on next year's points.
Correct.
That's a good point.
I have a question. Since you mentioned that, Ed, this is Mary.
Yes, Mary.
So we're not, just to have it out there too, so we're not going to be able to use any of the points that we collected this year to also use with what we collect next year for the points for next year after in October?
So, Mary, to answer your question, starting October 1st, so we paused the program, everything is not recording, everyone automatically got credit for this year. Starting October 1st, whatever you do from October 1st on will count towards the 2021 program, which means that will count for credit in the year 2022 since we do 1 year ahead. So as soon as 10-1 starts, everything starts picking up recording, you'll get credit for it. You're automatically going to get credit this year just because we voted to, pause the program and just give incentive credit.
So
Did that answer your question?
yeah, so everybody has to start over. We're not going to be able to carry anything from this year over. It's going to start, and just to be honest, we probably ought to make everybody aware of that. I mean, I realize that we're October to, is it August on our cutoff? You know, everybody should
Or
remember,
September.
but, you know, could someone be thinking, since we didn't use them this year, I can carry them to next year? We may want to think about putting some information out that if you know, all these folks, these 2,491 people, be employee or spouse, make sure they're not thinking what I've done now, which I'm grateful that they've done this stuff, but what I've done now really don't count for what's going to start counting in October.
Gotcha.
If I could address that just a second, we did send an email out. It's been a while, but when the county commission approved that everybody get the points, then we did send an email out saying that it would not be required this year, but the slate would be wiped clean, and as of October 1, you would start all over again. In that email, so you'd have to obtain your points for 2022, you would have to obtain those points in 2021 in this 2020 October 2020 till September 2021 for 2022 points.
It's a tongue twister.
Yeah.
And I did share that. I actually printed that email off and done a stuffing when we done the payroll. But we just need to remind them, because it's just like today's meeting. I had to say, okay, I need the link to it, and it had got sent to me in July for today's meeting. So we just need something, whether it's a reshoot of that email out when it gets closer to October, just to remind everybody, hey, this is fixing to start over again. Start on your points.
Yeah, and if, again, I agree with you. We've got a lot of communication pieces coming out with vendors changing, life, disability, the voluntaries changing, and other items that we have on the plate. So I agree with you, and what we will try to do is bulk those emails together, because I know people just get gobs and gobs of emails, and so we'll try to be careful that we just don't bombard people. But I agree with you 100% that you know, we're going to do all we can to let the employees know, and also keep the committee informed too.
Sounds good. Mary, you good with that?
Yes, sir. Thank you.
Okay. Any other questions on the report? Thank you, Chuck.
Thank you.
Certainly appreciate that. Next item is item number 7 on the agenda, the clinical transition update from Christy Martin. Are you with us, Christy?
All right. I think you should be able to hear me now. Can you hear me?
Yes, ma'am.
Apologize for that. Yes, the clinic transition is going very smoothly. We are very excited about Tuesday being our first day. Partnering with you all, Ed and Jane, Melissa, and the team have been wonderful to work with. We've got training that'll take place Tuesday morning, and then New Salem will begin seeing patients Tuesday afternoon, with all of the other clinics opening on Wednesday. So we're full speed ahead. Excited about working with Chuck. We had some conversation about scheduling some on-site school visits to promote services and just get the information out there that we're now engaged with the MedPoint clinics. We also have a microsite that is live, that is a resource for all of the members to utilize, and they can actually schedule online. We've had several patients scheduled to date, so things are moving smoothly.
Okay, any questions for Christy?
Of course, it's Mary, and y'all know I have one.
Oh, come on. You dig up one.
Well, I'm just kind of curious, because I've been talking to the guys around here and just made them aware that if they're needing to call the clinic, that, you know, we were closed and doing a transition. Christy, do you have any way of letting us know, and you may not, have you already have appointments made through y'all now for the folks that have been seeing, through our premise health? Do you know that you've already got appointments on the books for y'all now?
Yes, Mary, we do. Unfortunately, right now, the only way for them to schedule is online through our microsite. I know that there's a digital piece, an email blast, I believe, that Jane and Melissa are working on. Correct me if I'm wrong, Jane and Melissa, but I think they're working on a piece. We also had a postcard mailer go out yesterday with that information as well, and location identified there. And trying to think, and Ed, feel free to help me if there's anything else I'm missing, but we've tried to get the information out there because we do realize this is a gap. The clinics are closed and they're unable to kind of reach a person per se to schedule, but we do have the online option right now. We've tried to do our best to communicate that to the members.
But now, once everything settles, y'all will also have a telephone number that you will be answering for the ones that do not have the ability to do the online, correct?
Oh, yes, absolutely. And we were able to keep the same phone number. So we will have that active on the 1st. All of the staff will be in training the morning of the 1st. So we are in the process of getting a recording there so people understand what to anticipate with callbacks at worst that afternoon. But we're trying to have someone there to answer those phones that morning too. It's just a challenge with getting everybody onboarded at the same time. So phone numbers will be the same.
Great, thank you, ma'am. Just, my bunch don't like change, so we're just making sure.
I know, and we will have our wellness coordinator if it's helpful. As I talked about, with Chuck, we'll coordinate an on-site visit maybe to your department if that's helpful, and we can do some online scheduling there if that's beneficial to them as well. We want to meet everyone where they are, so whatever we can do to help bridge that gap, we want to do. Help them through the change.
Yes, ma'am, and I understand, and that would be a great idea because I have, there's 73 of us, 71 are men, and so they actually do use the clinic and stuff, so it would be nice to kind of put a face to who they would be talking to or possibly seeing. We did go over the changes that were being made with the Blackman Clinic. A lot of them go into it, and I told them that was no longer an option, but you were switching over to the 99 office. So we're hoping for a good change, but that would be a good idea to go out and kind of meet and greet some folks, especially since we're not having the health fair.
Sure, we can make that happen.
That all you got, Mary?
Yes, sir. Thank you.
Okay. Any other questions for Christy?
Yes, I have one. This is Shantae.
Shantae?
And Christy, I know you stated that you sent out mailers, postcards, but could you give me the email, the online portal for making scheduling appointments?
We can probably send this to this group. That might be easiest. It's a long URL, if that's okay.
Yes, that's fine.
Yes, we can certainly do that.
Shantae, you might be able to go back and look an email that the risk management office sent out, I think maybe about a month ago, and it had that link on there to be able to make those appointments.
Okay.
But if you need anything, just give us a call or send us an email, and we'll be happy to resend it. But we've got some other things coming out over the next period of time. I do want to mention something while Christy is still on the line. We're going to do a virtual ribbon cutting. I think it's, isn't it September the 15th, Christy?
Yes, that's correct. It's tentatively scheduled for the 15th for that morning.
Okay. And so that is set up, and we will be virtual. We're trying, I don't know if we're going to be able to get it done, trying to get a tour of the new facility and also have that up on the risk management website for everybody just to be able to take a look at it. And there's several other things. Mayor Kitchen, when you're through with this, I have one other thing under other business.
Sure. Any other questions for Christie before we let her go? Christie, we look forward to working with you. Sounds exciting, and kick this thing off next week. Any other business under other business? Ed?
I have one other thing. I don't want to leave the meeting without pointing out that I hope this worked for everybody as far as setting it up on SharePoint and doing these meetings virtually like we have. And I know my staff has worked really hard trying to put this together in the last couple of weeks, but I also want to point out that OIT has done a great job, Megan and Lee and Danny, helping us trying to coordinate this and just trying to do it in a better way. So if you had any problems with it or anything like that, send me an email, give me a call. The other thing was we're trying to get the minutes out to you quicker. We're trying to get the documents to you quicker. So I hope this will work.
Okay. Thank you for those comments. Any other business to come before the committee?
Mr. Chairman, it's Jeff Phillips.
Yes, sir.
If I could point out to Ed, as a member of public safety, I've asked, and as a committee, we've asked if it's possible to put together a total incident rate as it relates to workers' compensation. It would give us a little bit better handle on how we stand compared to the private sector and how we stand maybe to other governments as well. Dan said he had that information available, but as of yet, I've not seen that information, or we as a committee have not seen that information. And also, I understand that we're doing a pretty thorough job when it comes to accident investigation. And I'd like a little more information on that, at times, on the accident investigation. Once again, as a member of public safety, and that come through, like we had 15 accidents with the Board of Education. How many of those accidents were investigated, and the results of those investigation? Of course, when it comes to workers' compensation, there's different ways to look at things. I'm not dissatisfied with our workers' comp and the direction that we've gone in the last few years. Anyway, I think it's a pretty good performance, but the report card that I've always looked at in my 30 plus years as a safety director deals with total incident rate. Not necessarily concerned with dollars, because if your total incident rate comes down, your dollars always come down. And I'd just like to know how we're doing year to year, and then comparative to other folks and as well. And once again, when it comes to accident investigations, how many of those accidents were investigated? And maybe we can actually, as a committee and as a commission, understand a little bit better the type of accidents that we're having and the results of that investigation and what we did to correct that situation so that it doesn't happen again. If there's a way, Ed, you could follow up on that, and I'm not putting any timetable or anything on it, but maybe just look at total incident rate and have some report, if it's possible, have some report that comes back to the commission through public safety.
Commissioner Phillips, if you don't mind, I would love to sit down with you, maybe Dan and I sometime. I'll give you a call. We'll set up an appointment and just kind of if you'll walk us through that, and so we're providing that support that, you're comfortable with and you think that, will help the committee. I'll be happy to.
Okay, anything else, Jeff?
No, thank you.
Yes, sir. Anything else from any of the members under other business? Hearing none, then we will stand adjourned. Thank you so much for your I'm sorry? Motion to adjourn?
Motion to adjourn.
Motion to adjourn. Thank you, Jeff. I was just going to do it. Got a second. All in favor signify by saying aye.
Aye.
All opposed. Motion carries.